Hi, welcome back. So this module, we're going to be talking about work experience. Now, work experience forms the backbone of your entire application. One of the best ways that you can demonstrate your dedication to this career and your understanding of what the career involves is your participation in work experience. And of course, work experience is a key part of the application process. Whether you're asked about it directly or not, you will definitely end up talking about it in one way or another. It will be your fallback when you get asked a question that you're not quite sure how to answer, or they ask you to give an example of a scenario that you were in. You may not have necessarily rehearsed all of them, but genuine experiences and genuine work experience will automatically give you something or a story to tell that will fit to the situation when your back's against the wall. Now, I'm sure you've heard me say this many times, but there are essentially three types of work experience. And those are a regular paid job, shadowing in a healthcare setting, and finally, volunteer work. With regards to pay work, what I would say is don't underestimate any work that you've done. I think people don't realise some of the skills that they have gained, whether it be anything from babysitting to tutoring to even working in a shop. There are lots of transferable skills that you gain just from having a regular paid job. So I don't want you to rule out any of your experience just because you think it's not medical and it's not relevant. Try and have a think of some of the transferable skills that you have gained from some of the jobs that you've done. For example, if you're doing any job that requires you to be somewhere at a certain time, well then obviously that demonstrates that you're reliable to turn up at the right time. Reliability is a massive skill to have as a doctor. If you're client facing, for example, or looking after children when you're babysitting, these draw a lot of parallels with looking after patients. And then again, if you're client facing, you may have to deal with difficult situations or complaints, and how you handle that is really important. And of course, in medicine, it happens all the time where mistakes are made, or patients aren't happy with their care, or they're just generally not happy at being unwell and being in hospital in the first place. And you have to develop those skills to learn how to deal with that. And I'm sure that you can think of and you have experienced situations where at least the start or you've touched on those skills that are needed to help put people who are frustrated at ease. How about maybe if you worked in a team or you had colleagues that you worked with in one of your jobs? Well, team working is a massively important part of being a doctor, and definitely a transferable skill that you can attribute from having done a previous job. How about honesty? Maybe you worked in a job where you had to handle money, or you had to take care of stock. Maybe they even trusted you to have the keys to lock up. These are important skills to show that you are honest and people can put their trust in you. So have a think, are there any other skills that a doctor should have that you can relate to one of the jobs that you've done? And I'm sure if you rack your brain, you'll be able to find a few, if not many, from the jobs that you've done. So now let's go on to talk about the one that tends to worry applicants the most, which is shadowing. Shadowing is where you attend a healthcare setting and you attach yourself to usually a doctor or a healthcare worker to gain experience what life is like in a healthcare setting, and kind of get an understanding of the setup and how either a hospital, GP practice, or maybe even a care home works. So now I'm going to give you 5 golden rules that are going to help you with answering questions regarding shadowing. The first one is that you must keep a diary or keep a log of your work experience. Now, everybody falls into this trap of thinking that when something at the time was so vivid and so memorable, that they will remember absolutely every detail from the experience. And I can tell you 100% that you will forget it. You might forget the entire thing and it's an absolute gem that you could use at interview, or you might forget the little details that made it so effective, or the lessons that you learned from the experience. So make sure you keep a diary and keep it about everything, about the interactions that you had with the doctors, the lessons that you learned from talking to staff, and obviously the experience that you saw with patients. And make sure that before you go into interview, you read that diary a few times so that it reminds you of not only what happened, but what you learned and what it related back to, how it would either make you a good doctor or things that you learned that you would need to develop to be an effective doctor, whether it be coping skills or just general skills that need to be developed for you to be effective. The second thing I would say is it has been a big struggle this year for anybody to attain work experience. And before the pandemic, if you had done work experience already, then great. But since then, it's been almost impossible to have a face-to-face, in-person work experience placement. Now, if you did manage to get one, make sure that you explain the struggle that you went through to get it, because having that raw determination to, despite all the limitations that we've got at the moment, to actually push through and manage to get a placement is fantastic. So explain the difficulty that you had to show that you've got the resilience and the drive to push through and make that happen. Thirdly, don't ever forget the reason why you're doing your work experience. And that is to gain the lessons and experiences that you learn from it. So it's so important to reflect on what you've seen. It's not what you've seen, it's actually what you can take away from it that matters most. So make sure you have every experience, you have a good reflection, you always relate it back to how it would impact you or improve you as a doctor or just make you more suited to be a doctor. Number 4 is that I would say try and avoid the temptation to drop a name. The likelihood is that they may not have even heard of that professor, or it just simply won't impress them. And also, I think there's an element of, if you can show that you've done a not so glamorous placement in, say, care of the elderly, where it's a bit, there are some sad elements to it and there's a downside to it. And despite seeing all that stuff and being exposed to the harsh realities of being a doctor, it hasn't put you off the career and you're still with full awareness of what it's like wanting to pursue a career as a doctor, then I think that speaks a lot more highly than some flashy placement with somebody where you haven't really gained an insight into the realities of being a doctor. And my final golden rule is to not just give a robotic list of all the things that you did for your work experience. What they want to hear is, like I say, it's what you got out of it and what you gained from it that is going to be the most important element of your work experience. So follow the structure of what you did, then what you learned from it or the experience that you gained from it, and then always relate it back to how that will make you a great doctor. Okay, so now we're going to have a look at a video of a candidate answering a question relating to their work experience.